So welcome everyone to this Partners in Care webinar during Safeguarding Adults Week 2025. Today's topic is adult safeguarding and prevention. So welcome to the session. My name's Karen. I'm the safeguarding lead at Partners in Care. My email address is on the screen in case you require any further signposting after the session. Part of my role is to work closely with our safeguarding partners in Shropshire and Telford and Wrekin and support our members across Telford and Wrekin, Shropshire and Cheshire. So that's my role at Partners in Care. Partners in Care members are able to access lots and lots of resources, as are non-members. So you can see here, we have lots of training opportunities. We have lots of networking events. Our Safeguarding Adults Forum takes place quarterly. And in the next one, in December, we have things like Care Quality Commission talking. We have sessions on making bravery redundant. We have all sorts of things that you can use. And we have a really brilliant YouTube channel, which anybody can drop on and have a look at our playlists on there. So I really recommend that resource to everybody today. Learning objectives for the session today. This is a webinar, and we're going to be thinking about how a speak up culture acts to prevent abuse. We're going to outline how respect and active listening contributes to good safeguarding practice. We're going to illustrate how taking a making safeguarding personal approach contributes to prevention, and we're going to identify the role of empowerment, education, and support in prevention. We're going to describe how positive safeguarding cultures contribute to the prevention of abuse. So that's our outline for the session this morning. But when we talk about prevention, what do we mean? What does the care and support statutory guidance say about prevention? It says it's better to take action before harm occurs. And when we're talking about working with adults, the guidance tells us that adults should receive clear and simple information about what abuse is, how to recognise the signs, and what they can do to seek help. So prevention is firmly embedded in that care and support statutory guidance, and it's something that we should all really be concerned with. I'm going to show you a short film now. This is from Derbyshire Safeguarding Adults Board.
In Derbyshire, there are adults who suffer from abuse and neglect. Some adults will sadly be harmed by someone they know. They might be unable to report it because of disability, illness, or because they feel afraid to tell someone in case the abuse gets worse or in case they aren't believed. Some adults may not realise that the way they are being treated is, in fact, abuse. Priya's son uses her bank card to withdraw money for himself when he does her shopping. Sometimes this means Priya cannot afford to pay her bills, but she doesn't want to say anything in case her son stops visiting. Julie's husband has stopped her from seeing her friends and hits her when he has been drinking. This has been going on for years, but she hasn't told anyone. Daniel lives alone and feels depressed. He has stopped washing and eating properly, and his house is cluttered and dirty. His health is suffering, and now he has an infected leg ulcer, but has not contacted the doctor. Becky's boyfriend persuaded her to send some photos of her private parts to him. He is threatening to show her family and post them on the internet unless she does whatever he tells her to do. Martin has physical disabilities and relies on his carer to help him, but she ignores his thoughts and opinions about his day-to-day activities and teases him in front of his friends, which makes him feel embarrassed and worthless. Russell relies on his daughter a lot to help him get up, take his tablets, wash and make meals. Sometimes she doesn't turn up and he is stuck in bed all day. He missed his hospital appointment because she was too busy to take him, but he doesn't want to make a fuss. Abuse and neglect can take many forms and can be caused by someone the adult knows, such as a family member, carer, or friend. Often abuse is thought of as being physical, but quite often it is more subtle and may not be as easily noticed. Abuse can happen anywhere, including in the adult's home or in a care establishment. Keeping people safe from abuse and neglect is everybody's business. There is no excuse for abuse, and we need to know about it so we can stop it happening and prevent it happening in the future. If you know someone is being abused or neglected, or suspect that something isn't right, you should report it. If someone is at immediate risk of harm and in an emergency, contact the police. Telephone 999. Or you can use emergency SMS by texting 999 from your phone, or use the NGT Relay Assistant UK, helping people with hearing and speech difficulties communicate with anyone over the phone by dialing 180 000 from the app or text phone. If the person is not in any danger now, but there has been a crime, contact the police on 101. If you are concerned that an adult who has care and support needs is being abused or neglected, contact Call Derbyshire on...
Okay, so I think there were some clear types of abuse outlined within that animation. And one of the things they said very clearly around prevention was sometimes it's about preventing it from happening again. So prevention is that initial prevention, but it's also that secondary prevention, isn't it, as well? Stopping something happening again. So I thought we'd be a little bit interactive, but we're going to do it in the chat. Okay. So when we think about prevention, when you watch that animation, what were the tensions in the animation that made abuse more likely to be happening? So I know it's a big ask. It's a Friday morning. It's frosty. It's cold. But can you jump in the chat and can you please give us some thoughts? What are the tensions in that animation that made more abuse more likely to be happening? I'm not going to read out people's names, so don't panic, but I'm just going to review some of the things in the chat and then I'll share some of them out loud. So just give you a minute to think, what are the tensions in that animation that made abuse more likely to happen? And I can see some of you are answering the chat now, which is very much appreciated on a Friday morning. So thank you very much for that. So we've got a few things coming in now around someone having a disability, carers not having time to support due to their own life demands. Yeah. Close relationships affecting the ability to challenge behaviour. So again, going back to that kind of dependency, family dynamics can make things really challenging. Thank you. Yeah. Financial. People being particularly vulnerable. Yeah. Fear of becoming isolated. Dependency on family. Yeah. And what about that dependency potentially on alcohol and drugs? Being isolated has come through again. So there's a bit of a theme there, isn't there? So you can see, can't you, that when we think about prevention, there are some things that are going to make it a real challenge to support people around. And I think, one of the things that perhaps hasn't popped up in the chat so far is maybe insight into the situation. Maybe the person just doesn't simply recognise that what's happening to them is potentially heading towards that abusive kind of situation. So your next challenge, team, on a Friday morning. What were the barriers to preventing abuse? So was there something getting in the way? As well as the things you've mentioned so far, were there any particular barriers to preventing abuse in the animation? Let's see what you think about this one. What were the barriers? Yeah, thanks. Fear, potentially. Yeah, that's a really good one. Thank you, team. Yeah, confidence to speak up. Fear. Yeah, fear of raising those concerns. So what will happen if I tell anybody? What will happen to me, especially if I'm really dependent on that care? Yeah. Lack of confidence, fear, no self-worth. Potential loss of family connections, disguising the issue, symptoms so others will not notice, fear of losing relationships. So there are some quite significant barriers here, aren't there, to preventing abuse happening. And that kind of dependency is really important. And you've quite, mentioned fear and confidence. So there's quite a lot going on there for people. So from your point of view, thinking about the kind of roles that you have, can you tell me, why is preventing abuse difficult? So we're moving away from that animation now to think about your roles working with adults who have care and support needs, who may be accessing your services. Why do you think preventing abuse is difficult? Because I think it is a challenge. Why is preventing abuse difficult? Let's have some of your thoughts about that. Brilliant stuff, team. Yeah, some really great stuff coming in here. So some real challenges. Yeah. Communication, often not disclosed. So if it's not being disclosed, that relies on us having a real culture of vigilance, doesn't it? And being able to spot those signs that something's not quite right. Harking back to that idea of using our professional curiosity to ask those questions and find out what's going on. A lack of understanding of a situation from the adult's perspective, yeah. Consent and risk. Rocking the boat, yeah, thank you. That's a really interesting one. So if I say something, will it get worse? What will happen as a result? A lack of understanding. They may not be able to identify it exactly right. They may not have insight into it. And institutional failures. Yeah. So maybe things aren't in place to make sure that people are safe. We haven't got our systems right, have we, to make sure that abuse isn't happening. So we're not preventing it. Trust, knowing who to speak to. I think you've come up with some really, really good stuff there. I'm just going to see if there's a couple more coming in. Yeah, fear of getting it wrong. Yeah. And it's really challenging, isn't it? Because like I said, prevention works in several ways. We're looking at, ideally, aren't we, preventing abuse happening in the first instance. That's our ideal scenario. But if abuse has happened, how can we then work with that person to support them to prevent a reoccurrence of that? How can we do some educational work with people? One of the reasons, perhaps, that preventing abuse is so difficult is because maybe we don't do enough work out in the wider community to raise awareness of what adult abuse looks like. And therefore, people don't understand how to prevent it if they don't understand what that is, if that makes sense. So I think prevention's a real challenging area for us. So a couple of things I came up with, combination of factors related to the adult silence, which some of the things you've mentioned, the subtle nature of abuse and that kind of creeping effect that it can ramp up into something much more serious, societal denial, systematic barriers, which someone mentioned in the chat. So potential signs of abuse can be hidden, they can be unrecognised and unreported if it's happening behind closed doors, unless we're actually supporting that person. How do we know what's going on for them? That can be really difficult, can't it? The person posing a risk could be someone in a position of trust, such as a worker, volunteer, or a family member. So then how does that individual speak up and speak out? That fear of being believed. The adult could be dependent on the person abusing them, and the adult may not understand that things are escalating into an abusive situation. And therefore, there isn't that opportunity, is there, to get in early to prevent it from escalating. Challenges with adults and disclosing abuse, fear, intimidation, shame and guilt. The person might feel it's happened because it's their fault. Negative past experiences, how does it impact on their ability now to deal with it? A lack of recognition and language to express what's happening. Someone mentioned in the chat earlier, communication, that can be a real barrier. And how do you tell someone what's happening, especially if you don't really understand that yourself? And isolation. Systematic and societal barriers, denial and that kind of attitude, not our problem, not our role, nothing to do with us. Maybe a lack of professional knowledge, inadequate support systems. Cultural and social norms mean that the person doesn't recognise that this is abusive because for them, it seems like it is the norm. Protecting the organisation, so that fear of reputational damage and vulnerability factors. So some people may be more vulnerable in their situation due to factors such as their dependence on others, for instance. So I think all in all, it's quite easy to see from that, isn't it, that prevention can be a real challenge to us. So what can we do? Can we work to prevent abuse? What do we need to have in place to prevent abuse? And I'm sure that you will be able to add to this in the chat. But things like robust recruitment. And if you're not aware, the Better Hiring Institute has a care toolkit, particularly looking at recruitment. And hopefully by the end of November, we'll have a revised version of that. And that kind of toolkit really places safeguarding at the heart of our recruitment processes. So it's really important. So I'll drop the link into you after this, and I'll put it on YouTube as well. Empowering individuals, building the adult support networks to provide a safety net. How about when the adult only ever comes into contact with paid workers? Does that make them less at risk of abuse, or does it make them more at risk of abuse if they don't have that wider safety net? Well-trained and supported workforces. How do we use our supervision processes? Do we use it just around performance, or do we use it as a collaboration with our staff to support them as a guide by their side, supporting them to think about their work role? Multi-agency collaboration. Community awareness, I said earlier, I don't know how much work we do effectively outside with our communities to raise awareness. Going back to that idea of a safety net, if our community has a really good awareness of what abuse is, they'll be more likely to spot those early warning signs and be able to take action. Robust policies. What about overarching safeguarding strategies so the expectations of everyone involved in your organisation are clear? Person-centred support. Embedding dignity. Has dignity gone off our radar? How many of your teams are dignity champions? Is it embedded in your culture? Reducing the risk of carer breakdown. How do we support informal unpaid carers in their roles? What do we do to support that? How can we promote an open culture where people feel safe to speak up and speak out? Good record keeping and communication. Record keeping is absolutely crucial. We all know, don't we, that if it's not written down, it didn't happen. Is it everybody's favourite part of their role, record keeping, documentation? I don't know the answer to that, but I do know from a safeguarding perspective, it's really, really important. It identifies issues, themes, trends. It allows us to identify when things maybe are going wrong so we can get in early and put things in place to prevent things from escalating. Safe care and treatment practices, a learning culture. And what do we mean by a learning culture? Are we talking about a tick box culture where we say that we have learnt the lessons? Or do we really think about how we can apply something in our own practice? What can we take away from that? Can we question what we're currently doing? Can we think about doing things differently? Safe care and treatment practices. Quality assurance and monitoring processes. How do we make sure that what we're doing is okay? How do we do that in practice? Do we do a little bit of auditing? Do we talk about safeguarding? Do we keep it on our radar? Are we aiming for over and above the minimum compliance requirements? Are we aiming for gold standards? Reducing the risks of a closed culture developing. Do we engage with other partner agencies? How do we do that? Do we work with families? How do we do that? Do we bring people in from the outside? Or do we do everything ourselves internally? Do we access joint training so we come along like sessions today when we're with other people, or do we do it all on our own? There are a range of ways in which we can work proactively to prevent an abuse happening. Now, I haven't seen anything dropping into the chat, but if anything occurs to you, what else can we do to prevent abuse? Please let me know by dropping it into the chat whilst I carry on. Another thing I thought about when I was thinking about prevention is that early detection, because early detection prevents abuse. If something's not yet at that level where it's abusive, but we think something's not quite right, if we can get in early, that's going to help it escalate, stop it escalating. The identification of potential safeguarding risks at an early stage is essential for the prevention of harm. So how good are our colleagues at spotting the signs? Speak out cultures can help organisations detect potential wrongdoing or poor practice as early as possible. This can help to prevent future abuse, while also ensuring people using services will be better protected. Safer policies and procedures will be embedded across the organisation. Adults who use services and those working with them will better understand the organisation's expectations. Staff will be trained beyond compliance, understanding how to recognise poor practice or safeguarding concerns. So when we think about the nature of our workforce, do we all need the same training, the same level of training? Or do some of us need higher levels of training to support people in different ways? So is it a tick box culture, or do we need to think about more personalised approaches? Training is a building block. What do we do after that? Do we do bolt-on sessions? Do we talk to our teams in staff meetings? Do we listen to people in supervision? And maybe not just badge it as, do you have any safeguarding concerns? Because that sounds very specific. We want to know more than that. We want to know how it feels to work in an organisation. What is the culture like in that organisation? If we're going to prevent abuse, staff will need to feel competent and confident about reporting, knowing that they will be listened to, that they won't get the roll of the eyes or the, you again, that they will be listened to, that they'll be welcomed to share those comments. So I'm sure you're all familiar with the notion of making safeguarding personal. How does making safeguarding personal, involving adults in safeguarding, how does that support prevention in the future? Let's find out. So when we think about making safeguarding personal, we're often thinking about how we involve the adult, that wraparound support for the person, being listened to, being understood. And I quite like one of the things in the animation that they mentioned was that circle of support. Sometimes when we do training, we get people to identify who is within that circle of support. How close to that person are they? How far away? So the circle of support involves lots of people that that individual comes into contact with. It could be immediate staff teams, immediate family, for example, but it could be other people in their life. A taxi company, taxi drivers that they often come into contact with, they use the same company. What about the hairdresser? What about the dentist? What about the GP? Lots of people are in that individual's circle of support. What about the sports club that they go to? What about the pub that they go to have a meal? Do they see those people on a regular basis? When you think about the circle of support, how do we involve that person's circle of support to keep the individual safe? And actually, how do we educate and inform the circle of support so that they also recognise what abuse is and how they have a role to play in preventing it? We're going to think about speaking up now. And I think speaking up cultures are really important in terms of prevention. So we're talking now about our workforce speaking up. Obviously, we also need to make sure that the adults who we support can also speak up and can potentially recognise when something's going wrong and share that information so it can be dealt with. We all know how speaking out about poor practice or wrongdoing can help prevent abuse and neglect from happening in the first place. But how easy is it to stand up, to speak up? When we think about our staff and volunteers, they are the organisation's most valuable sources of intelligence. So we need to ensure that everyone concerned with the organisation knows how to call out poor practice when they see it, to stop it. Plus, everyone should feel that they can trust the people and the policy to support them if they choose to speak out. And everyone should know how to formally escalate a safeguarding concern. So I want you to start to reflect on your speaking up culture in your organisation. How easy is it to do that? Strong leadership at every level is essential in developing a speaking out culture. Trustees and senior teams should set the tone of safeguarding. Managers and support staff should then implement best practice guidelines across the organisation. That was a very badly timed cough. How about thinking about self-advocacy groups for people who use the organisation's services? And as a whole, the organisation should adopt a learning culture where everyone feels free to share their ideas. So learning isn't just about going on a training course. We all know that. But how do we create those cultures where people feel able to share their ideas and their thoughts, their observations? What have they seen? What have they noticed that really works within that organisation? I'm going to show you a short film now, which is called Creating Speak Up Culture, How to Support and Protect Whistleblowers. I really like this short film. And while you're watching it, I'm going to ask you to reflect on the organisation that you work within and to think about how well are whistleblowers supported in your organisation.
Some see them as courageous. Some see them as controversial. What's clear is their role in driving accountability and change. Today, we recognize the courage it takes to speak up. Whistleblowers are not seeking the spotlight, they are seeking solutions. They come forward not because it's easy, but because they believe in something greater than themselves: the truth, the law, the public good, and ultimately trust. Coming forward often involves real risk. Retaliation, professional isolation, and personal scrutiny are just a few of the challenges whistleblowers may face. Even with legal protections, fear remains a barrier. That's why early support, listening, protecting, and responding appropriately is critical. How we act in those first moments matter greatly, both for the individual and for the organization. A strong speak-up culture doesn't happen by default. It's intentionally built through transparent policies, consistent leadership, and systems that reinforce accountability. When employees know that their concerns will be treated seriously and confidentially, they're more likely to raise issues early. That's not just compliance, that's culture in action. Encouraging whistleblowing isn't just about mitigating risk. It's about enabling ethical decision-making, protecting your people, and strengthening your organization's resilience. Data shows that when employees speak up and when companies act on those reports, it leads to safer, healthier, and more sustainable workplaces. That's the long-term value of getting this right. Trust is built on how we respond when concerns are raised. Whistleblower protections alone aren't enough. We must create environments where every individual feels safe, heard, and respected. That responsibility belongs to all of us, and it starts with how we lead, we listen, and we act.
So I like that notion of protecting your people that was mentioned in there. And I'm just going to ask you to take a minute to reflect on that. What kind of things do you have in place in your organisation that means you have or you are creating a speak up culture? So I'm just going to pause for a minute to give you time to reflect on that. And if you want to drop some things in the chat, that of course would be very welcomed. Have you got a speak up culture? Are you working to create one or develop one? And how are you doing it? Let's have some thoughts in the chat. So I can see some things coming in, which is very welcome. Thank you. Because I guess the challenge is we might think that we have a speak up culture, but how do we know? How do we test that out? How do we temperature check, if you like, that we have that culture? How do we know when people feel comfortable to speak up and speak out? Do we recognise that there may be some vulnerabilities within our workforce, that some employees may be more vulnerable if they speak up than others? So I've got a few things in the chat. You've got safeguarding leads to seek advice. So we've got that notion, haven't we, that safeguarding is everybody's business, that we all have a role to play. But when we've got safeguarding leads in the organisation, that gives us that extra level, doesn't it, of support, advice, guidance, someone to bounce your ideas off. Open, honest conversations from supervision gives the feeling that you're able to do the same. Yeah. So telephone numbers of management are available. You also have got a commissioned whistleblowing hotline so that information goes outside of the organisation. Safeguarding concerns feature on agendas and in multidisciplinary team meetings. Trust between staff and management and good working relationships. So quite a lot of things going on within your workplaces. And how do you know about the things that you're missing? I'm just putting that out there. Designated safeguarding leads. Team to offer advice and support. Safeguarding reporting software with clear procedures around what to report, including low-level concerns or niggles. I like that, because if people are able to report those low-level things before it escalates into something serious, that feeds into our agenda around prevention, doesn't it? Because it means that we can get in early before something is escalated. Weekly MDT meeting processes. Good communication with colleagues and building positive relationships. And I think there is something there, isn't there, about building those relationships. A positive speak up culture, it doesn't just happen. It's something that does need to be built and developed. Regular team meetings, touching in with staff, touching base, if you like. Okay, so you've got quite a lot there. And like I said, it's not something that happens. You really have to work at this. And when you think you've got close to that point where that speak up culture exists, you can't take your foot off the gas. You have to carry on working at it, because it only takes a few negative experiences to pull that back down. So you've got to keep working at it. Close working relationships with mental health social work team for advice. So yeah, partnership working, making it a kind of open culture where partners are involved in the way that you do things. Okay, right. So let's move on a little bit then. When employees feel safe to speak up, they are more likely to be engaged and committed to the organisation. Think about retaining your staff. When employees feel safe to speak up, they are more likely to be engaged and committed to the organisation. They're more likely to have that culture of vigilance, where they see something, they say something, they do something. We're always stronger together. And in an organisation with a strong speak out culture, there can be productive collaboration between people using the service and professionals supporting them. Anyone can contribute to the conversation, and all voices are equally valid. I think we're all going to agree with that statement. Okay, so I'm just going to show you another film. This one is about speaking up cultures again, and it's thinking about encouraging the upstanders. An upstander is a member of staff in the adult social care workforce who may come across something inappropriate, some wrongdoing, let's say, and they intervene, they act on it, or they have a gut feeling something's not quite right here. And what they do is they find out some more information to ascertain if something is wrong, and they act on it. They share it with the senior management team, they work in line with their policies and procedures, they uphold their duty of care. And that means that people are being protected, supported, and they are actually being safeguarded. In contrast to that though, we could have someone who's a bystander, who also sees some wrongdoing in their workplace, in their role, or they have a gut feeling something's not quite right here, but they don't act on it, they don't intervene, and they don't follow that up. They fail, you could say, in their duty of care, and they actually end up colluding with that wrongdoing by not taking appropriate action. In that case, that person doesn't keep people safe. People are not safeguarding. We want to develop a really positive safeguarding culture. And that means we want a workforce made up of upstanders, people who understand their accountability, their responsibilities, and they want to act, because when you speak up and speak out, you are showing compassion and you're working with people. In terms of our adult social care workforce, what we want is for when staff in adult social care look in the mirror, what they see reflected back at them is someone who is an upstander, someone who speaks up, speaks out, takes appropriate action and safeguards those adults using that service, because the actions they take really can make a difference and impact on people's day-to-day experience. Thanks, Karen. Okay, so when we're thinking about our workforce, how do we encourage the upstander and discourage the bystander? What can we do to encourage people to be accountable, to be responsible? How can we set out our expectations that we want people to speak up if they see something that's not right, to act on it, to not wait until a later point, to get in early and help to contribute to that notion of prevention? What are your thoughts in the chat? How can we encourage our teams to be upstanders? Thanks for starting us off. Yeah. Believing in people and respecting their opinion. So when somebody approaches us to tell us about any concerns that they might have, it's about being open to that, isn't it? And, you know, how approachable are we in our day-to-day role? Do we make time for people? Do we have those conversations? Taking concerns seriously? Yeah. And acting on them. Yeah. Making it clear from initial onboarding that whistleblowers will be listened to. And, you know, you may not agree with me, but is your policy called whistleblowing? Ours isn't. Ours is called speaking up about wrongdoing, because our team decided that we didn't like the term whistleblowing. We decided that calling it speaking up about wrongdoing sounded a much more positive action. So think about, how do you get buy-in from your team, even around your policies? Can you collaborate? Can you talk to your teams and see what would make it easier for them to speak up and speak out and be that upstander? How are they listened to? And thank you for that one. Yeah, really listening to people. Not rolling the eyes when somebody approaches you. Encouraging the upstander rather than the bystander. But I do think we also need to recognise vulnerability across our workforce, that some members of our teams may be more vulnerable or feel more vulnerable if they speak up. How safe do they feel to speak up in their role? And equally, when we're supporting adults, how do we support adults to tell us what's happening for them, how they feel? How do they feel about the culture? Do they feel that if they speak up, they'll be listened to? Do they feel that they know who they can talk to? Who else can they talk to outside of their immediate staff team if they need to, for example? Where can they go? How do we educate and support people? And so just really as a way of kind of drawing some of that together, prevention is always better than a cure. I want you to think after today, what can you do differently to prevent abuse? What are you already doing? Have a go in your organisation at trying to identify that. Write it down, look at it, reflect on it. What can you do differently than you're already doing? What about some more education for the adults who you support? What about some community work? How can you champion and celebrate your prevention activity? How can you show off about what you're doing good, what you're doing well, and what can you do differently? What can you do better? What can you improve? So there are some of the thoughts that I want to share with you about today. So we've talked about adult safeguarding and prevention. This has been a very short session today. Clearly, there's lots of things that we haven't covered. We haven't talked about things like risk and all of those kind of areas, which are really important, aren't they, around prevention? So you will have access to the recording. If you're watching this on YouTube, underneath, I'll drop any resources that were mentioned in the session. Thanks for listening. So this has been a Partners in Care webinar to mark Safeguarding Adults Week in November 2025.